Hello and welcome everybody to today's presentation. You are here on September 22nd, 2020 for the Remodel CAN 2-102.6. Today we are going to be going over what is a remodel, some definitions, applying the Remodel CAN, using the Remodel flowcharts as well, and some other good information that you'll find handy. If you haven't done so already, we've provided the actual PowerPoint presentation for you in the Go-To module, so you can go ahead and feel free to download that and print it for your use. And we've also provided the actual remodel cans, 2019 remodel can 2-102.6. So you are here for an hour and 30 minutes. We will be providing a question and answer portion towards the end of the presentation. Please remember to keep your questions during the presentation today, more general format. If you have a specific question regarding a specific project, please first feel free to reach out to your field staff, whether it's your RCO, your compliance officer, your DSE, which is your district structural engineer, or your FLSO, your fire life safety officer. And RCO, of course, is the regional compliance officer. And if you have general questions about this presentation, feel free to email them over to the email address we have, which is webinarroom@oshpod.ca.gov. Again, that's webinarroom@oshpod.ca.gov. You will all be muted during the presentation, so if you have a question about this remodel CAN presentation, please feel free to insert or type that question into the question box in the Go-To question portion, and we will go ahead and get to those questions at the end, and we will provide answers to those questions the best we can. If we have transmission difficulties, if we experience transmission difficulties, we will go ahead and ask you to log back in using the same registration link that was sent to you by the Go-To software. And we will do the same if we have transmission difficulties on our end as well. So today for our presenter, we have Mr. Richard Tannehill, Senior Architect and Supervisor for the Building Standards Unit. So he's going to do the presentation, and he's going to be answering the questions at the end of the presentation as well. So with that, thank you, Richard, and I hand the mic over to you.
Thank you, Caesar. Hello, everyone. Welcome. Remodel CAN and the alterations for healthcare facilities. The CAN was released back in November. We've had actually several presentations on this over the years, so you may or may not have attended it, but it has garnered a lot of interest. So we actually keep repeating it just because there's a lot of good information here that'll help you out on your projects. So the first thing we want to start out with is, what is a remodel? If you look in the building code, there is no definition of remodel. So the answer is, it's an alteration. So what is an alteration? An alteration is defined as any construction or renovation to an existing structure other than repair or addition. An alteration also means any change in an existing building which does not increase and may even decrease the floor or roof area or the volume of the enclosed space. So basically, it's almost everything other than an addition or a new building or a repair. So when does the CAN apply? It applies for existing structures. A legal occupancy of any structure existing on the date of adoption of this code shall be permitted to continue without change, except as specifically provided in this code. So basically what that's telling us is that if a building is built in compliance with the code in which it was permitted, it can remain in use as is indefinitely, unless a specific provision comes up. It's typically like fire life safety or any safety stuff. A good example of that is the Alquest Act that required existing hospitals to be upgraded seismically. But we don't see this very much. So as a general rule, if it is built in within compliance with the code, it can remain in use as is indefinitely. And that's a key point for this whole presentation, so something to keep in the back of your mind. So we're looking at additions, renovations, alterations, or repairs. They shall conform with that of a new system without requiring existing systems to be in accordance with the requirements of this code. So any new equipment being added, new construction being provided must meet current code, but does not necessarily mean the rest of the building needs to be brought up to current code. Okay. Additions, alterations, renovations, or repairs to existing systems shall comply with the provisions for new construction. So let's look at those definitions. An addition is an extension or an increase in floor area of height of a building or structure. Basically, you're adding on to an existing building. And a renovation is basically returning something back to its original or new condition. This would be like renovating a car or an old historic home. So we don't see a lot of renovations being done with healthcare. An alteration is a change, addition, or modification in construction, change in occupancy or use, or structural repair to an existing building or facility. And then it goes on to list remodels, renovations, rehabs, reconstructions, historic restoration, et cetera, a bunch of different stuff. Again, this basically says an alteration is anything other than an addition or a repair. Okay, and a repair is the reconstruction of or renewal of any part of an existing building for the purpose of maintenance or to correct damage. So these definitions will come into play as we move through this scan. So a change in building occupancy or use. Building systems that are part of a building or structure undergoing a change in use or occupancy, as defined in the building code, shall be in accordance with the requirements of this code. So if you're changing the occupancy or use of a building or a significant portion of a building, you do have to meet current code requirements. This is primarily for the systems like mechanical, plumbing, and electrical systems of the building. A new definition that came out with the existing building code, Part 10, it does not apply to OSHPD 1 hospitals, is the change in character of use. Basically, what this is stating is that a change in occupancy with no change in the occupancy classification shall not be made to any structure without basically shall be only as necessary to meet the specific provisions, as it's not intended to require the entire building to be brought into compliance. So if you are changing there's no change to the occupancy, you're going from a B to a similar B occupancy, there's no change in the requirement to upgrade the whole building to current code. Another example of this, we introduced the 1R with the 2019 building code. And if you're switching from a 1R to from an OSHPD 1 to an OSHPD 1R, where the reuse of the SPC1 building incorporates services supporting that one OSHPD 1 facility, you do not have to bring up the whole building to current code. So that 1R building that had acute care services removed does not have to be completely renovated for its repurposing. So let's look at a change in function. The change in function is a change in the activity or services provided within the project limits that does not change the use, specific use, or occupancy. Keyword here being project limits. One thing to be very clear on, what is the scope of the project? And we'll come back to that as we move forward. Okay, what is required when you do a change in function? What the code says, it requires compliance with all functional requirements for new construction. It doesn't say it has to be brought up to full building code. It just has to meet the functional requirements of that section. So let's look at an example of that. If you're switching from a med-surg unit, remodeling it to a pediatric unit, the pediatric unit has additional functional requirements. It requires an exam and treatment room, a play area, a common patient toilet near the play area, infant formula, storage for toys and recreational equipment, and isolation room. So if your med-surg unit is being converted to pediatric unit, you only need to provide those additional functional requirements. All the existing functional requirements, the patient room is still a patient room, does not have to be upgraded. Okay, so only looking at the new functional requirements. Now, if you switch this and you're going from pediatric unit to a med-surg unit, what are the new different requirements for med-surg? There actually isn't any. You can actually do this with zero construction. You just reassign the rooms that might have been used for these other areas, play areas. But you can conceivably do a zero construction change from a pediatric unit to a med-surg unit. And we're looking at change of occupancy, looking at chapter 3 of the CBC of changing the different types of occupancy. And this does have a different requirement. The change in occupancy shall not be made to any building unless that building is made to comply with the requirements of the CBC for the use or occupancy. And if you notice here, it does say it has to comply with the requirements of the CBC, the building code. So there is a requirement that it be upgraded to current code when you're changing occupancy. Okay, changes of occupancy shall be permitted without complying with all of these requirements of the code for the new occupancy, provided that the new occupancy is less hazardous based on life and fire risk than the existing occupancy. So let's look at some examples of that as well. OSHPOD 1 to a 1R we looked at before, where the reuse space of the SPC1 building incorporates a different use. Now you're putting in a type of use that does not support the OSHPOD 1. You're looking at a change of occupancy. And then the requirements of that space would need to comply with the building code unless the space is less hazardous. So you're going from OSHPOD 1 to a 1R, it's probably going to be less hazardous, so it won't have to comply with all the new codes for that space. And that's, again, looking at systems. So if you're looking at it going from an I to a B occupancy, if you're converting old patient rooms, there are different requirements for that B occupancy. The B occupancy will require you to add closers and to your patient room, the old patient room doors. Okay, so that's the kind of things that we'll be looking for. Change in occupancy load or occupant load. If you're changing the load of a space or a department, you need to look at the egress of that building or portion thereof. Okay, so an example is changing from an office to a conference room. We always get the argument we're not changing the use, but going from an office to a conference room is a change of that use of that room. And there may be additional requirements like exiting from that room depending on the occupant count. If you're going to change from a dining room to a storage, you're going actually to less occupants, but you may have a stricter fire rating requirement. So that needs to be looked at. If you're going from an assembly room and you're making it larger, you may have adequate exits for that existing assembly room, but when you make it larger, you may have to add additional exits. So that's what we're looking at about for a change of occupancy load. Also, the type of occupants matters, okay? If you're changing the type of occupants, including ambulatory, non-ambulatory, bedridden, restrained, that's a big one, developmentally disabled, inpatient, outpatient, or to a non-patient use, public, staff, adults, children's, infants, all those things need to be looked at and considered when you're changing the type of occupants. If you're going from a med-surg unit to an acute psych, you're still doing a patient ward to a patient ward, but the requirements for acute psych patients is significantly different from the med-surg patients. So all those things need to come into play and be applied to your new project. So let's look at some flow charts. The remodel can is kind of known as the flow chart can. And we won't go into detail on all of these, but I do want to highlight some points in each of these. So the first thing we're going to look at is the mechanical flow chart. The mechanical flow chart is basically going to ask you a specific set of questions if you're changing the use or occupancy here, and if you are, you need to comply with current code. Is an addition to a building? Yes, you're going to need to comply with current code. If it's not, an alteration that changes the occupancy, use, or function of a space or room, if it's yes, you're going to need to comply with the mechanical requirements for that new use. So as we continue down here, it's the type of change. If it's an equipment replacement, we're looking at imaging equipment and other types of equipment. If HVAC capacity complies, no mechanical changes are required. If not, you need to meet current code. So there's a lot of things here that gets into types of equipment and stuff. So this, you can just look at this, and if you have any questions, you can contact us for your specific project. So let's look at some examples for mechanical. If you're replacing an HVAC unit, again, you want to identify the scope of the project. The scope of the project is this existing HVAC unit is old, you're putting a brand new one in. The scope of work is going to be exactly that. You're pulling the old one off and adding a new one. There may be minor alterations required due to duct relocations to align with the new unit. A lot of these units are custom and they can work with the existing openings. But this is your scope of work. You do not have to take anything downstream to the ducts, to the dampers, to the rooms, etc. And there are requirements that this would be comparable to the unit being removed. And if you have specific questions on that, you can contact us, but we're going to be looking at the CFM capacity, the tons, all that, the weight of the unit itself to make sure that it's will work with the same support structure. Let's look at a smaller unit. For a small HVAC replacement unit, or package unit, you see a lot of these on the single story areas or skilled nursing facilities. You can replace a single unit this is your project. Basically, it's from the curb up. You're replacing this unit. You need to comply with capacity, filtration, to make sure they're similar to what's there. Now, you're replacing one unit and say, well, this is my project. I don't have to do anything downstream. There might be some minor adjustments to the ductwork underneath to connect it. That's fine. Once we did this and told people, well, you can do this as this is your scope of project. Nothing else is required. You can swap these out. They say, well, what if we have 40 units we want to do? Can we do that as simply? And the answer is basically yes. There are going to be 40 units, so we're going to want to see what they serve. What we're looking for is any dietary or is subacute been added to the facility recently or the last few years that may have different requirements for those existing units that may not have triggered when that unit was put on originally. And that's where we get into the essential power here. Essential power may be required at the subacute that wasn't triggered before, and it would need to be brought in for that unit. But not all the units, just the ones serving the subacute area. Since we're on this slide here, we have just released an expedited building permit that is all online for skilled nursing facilities where you're replacing a unit similar to this. And it really helps the process. It can be done all online, and all the application, you just fill out a series of questions that you comply with capacity, filtration, grounding, etc. And you can use that. And that's on our website as well. So let's look at some plumbing revisions. If you're doing some plumbing modifications, we will look at fixture counts to make sure that the service being modified meets the requirements, the required fixture counts. That's going to be toilets or labs, hand washing stations, etc. And we're going to look at accessibility for those units. So looking at the electrical flow chart, you can see here across the top, we have a whole series of things that you can do. But as you follow it down, kind of come up with the same thing. All new elements of construction comply with current code. So no matter what you're doing, you have to comply with the current. Basically, it's the key here is all new elements need to comply with current code. If you actually read these and read the narrative that goes along with this in the remodel can, there are exceptions where you do not have to update certain things. But again, just look through this and read the narratives that go along with this. There are a lot of useful information there. So let's look at some examples for electrical. Replacing a nurse call system. Basically, that's your scope. You only have to replace the nurse call head end, the control unit, and possibly the patient and the annunciator stations that are provided. Nothing else is required to the rooms, etc., to be done when you're replacing these units. If you have to replace the conduit, same thing. Or the electrical that connects everything, the low voltage, same thing. That's all you're doing is replacing this unit. You're allowed to do what's required to replace the nurse call unit. We get a lot of questions about wireless nurse call systems. They are allowed. As of a few months ago, I do not know of any that will work in a hospital, not because they're not allowed, but just because they don't have all the required functions, but they are being used quite a bit in skilled nursing facilities. Now, these would be allowed with, I think it's a two-way patient communication for hospital settings. If you're replacing a generator, again, identifying the scope. If the project is solely replacing the generator, that is the scope of your project. You do not have to go downstream for any upgrades other than that's required to get that new generator in place. Looking at an automatic transfer switch replacement, here's an example of one that an existing unit that was getting old, needed to be replaced. They did set up a temporary system on a skid and wired it up, got it functional, and they were able to pull out the old system and replace it with the new one. Again, this was the scope of the project. Did not have to go beyond the walls of this room to do anything. While we're on this slide, if you were doing something as replacing a generator with a temporary generator, you would go to the temporary equipment can to apply those requirements. Okay, so let's look at the architectural. Architectural flow chart is new to the CAN. And so I want to kind of walk through it in a little more detail. Basically, what we're looking at is, does it fall under the change of use function occupancy or occupancy load? So as I stated before, one of the first things you always want to do is define the scope of work. Be really clear on your drawings when you're defining the scope of work. I'd say about 95% of the projects we get in, no matter what the scope is, we get a single sentence description of what that project is. And it really helps if there's just a little more information in that project description to kind of identify what you're actually doing. But you want to define the scope of the work. And then the questions you're going to ask is, does the alteration change the occupancy, use, or function? If no, it's probably going to fall in a couple other categories here. Is it equipment maintenance, replacement, or repair, or is it cosmetic? In this case, we're going to say it's equipment maintenance or repair. And then we're going to ask, is it a component or subcomponent? A component would be considered like the HVAC unit we were looking at earlier in the example. It's the whole HVAC unit. The subcomponent would be a component within that HVAC unit. So if it is the whole subcomponent or the whole component, excuse me, the component must comply with current code. Again, the new unit going on has to meet the requirements for current code. The anchorage has to meet the requirements for current code. But again, you don't have to take anything downstream of that. That's your scope of your project. Now, if you're doing a subcomponent within that unit, you can just replace that subcomponent to comply with the code at the time the HVAC unit was originally installed. So if you're replacing a fan motor or something within there, it's considered a maintenance item, and you can just replace it. No other requirements apply. So let's look at if it was cosmetic. Cosmetic does not typically require a permit. We're looking at paints, carpeting, tile. You're just replacing that, replacing what's there. What we do ask is that you notify the compliance officer for the facility that oversees that facility, and let them know that there's some work going on, so they don't come out and see something happening and not know what it is. But this is more of a courtesy. You can repaint. We've actually gotten projects in that were just 100%, cosmetic. We do not require a permit for that type of work. So again, just notify the compliance officer or talk with them if you have any concerns about it. An example of that is if you're replacing carpet. Well, we want to make sure it doesn't block any of the egress while it's being worked on, because you may have to close down sections at a time when you're replacing carpeting. So if it was a alteration or change in occupancy for use or function, does the entire facility change occupancy, use, or function? Okay. If the entire facility or even a major department changes use or function, you must comply with the current code requirements that pertain to the new occupancy, use, or function. Okay. If it is a change in function only, this requires with all functional requirements for that new use. So the section that you're applying, be it med-surg, pediatric, ICU, the requirements of that section have to be applied, the functional requirements. New elements must comply with current code. Anything new going in, other than like a subcomponent for repair or maintenance, must comply with current code. Okay. Utilities may comply with the code in effect at the time of construction, but you have to let us know that's what you're doing. Okay. So if you're adding, a new imaging equipment, and we'll get into that in a little bit as we go through, the utilities serving that do not need to be upgraded unless it's required for the new unit. So if it's not a change in function only, the area or addition of the alteration must comply with current code. The utilities, again, may comply with the code at the time it was originally constructed. A change in function will not trigger system upgrades. So let's look at some additional examples. If you're taking an old patient room here on the left, and you're going to convert it to a dialysis room on the right, again, define the scope. Okay, what is the scope of the project is really within these four walls. Okay, we're assuming everything's going to be edited or demoed out, and the new stuff's being put in. So your requirement is within the walls. Now you do have new plumbing that may go in, new electrical. You may even have to adjust the air exchange changes per hour, the air volume coming into that room, new finishes, etc. Your scope of work is limited to that room. Now let's look at imaging equipment replacement. This raises a lot of questions. Let's take an MRI, for example. You're replacing the MRI equipment only. No changes to the room itself. No wall movement. Okay. You are allowed to do this with, and that's basically your scope of work. You're replacing the imaging equipment. You're allowed to replace the equipment that controls the MRI, the control station. All can be put in without triggering any other upgrades in that room, including accessibility. Now, the room would require accessibility around the new imaging unit. You still have to have your clearance, your 3 feet around the table, and you are allowed to do any construction required to replace the new equipment. If you had to remove these doors or and replace them, or a new control station, that's fine. That's required for the equipment replacement. But if you have to remove the walls to relocate them to get the clearances required, that is no longer an image equipment replacement only. That's considered a alteration and would need to be brought up to current code. Same with the slab. If you have to demo the slab to do this and put a new slab in, that goes beyond the image equipment replacement requirements. With the CT scanner, we're getting a little bit more technological when we're coming to replace CT scanners. So there may be some additional questions asked of you when you're submitting for a CT scanner replacement. It's still an imaging equipment replacement, but as technology has progressed over the years, so has the type of treatments or procedures that are being done in these rooms. Originally, CT was 100% diagnostic, and that's maybe what the imaging room that it's sitting in was designed for. Now they're moving on to more treatment type facilities, interventional type procedures that may require a different environment that room is no longer suitable for. So when you're submitting a project for a CT scanner replacement, and it could be other imaging equipment replacement projects as well, you most likely are going to be asked for what procedures are going to be done in this room. Those list of procedures, go to CDPH and confirm if the room can remain as is, or if it does need to be either relocated to a more sterile environment, or the environment that it's sitting in be upgraded to provide a more sterile environment depending on the type of procedures. We are working on clarifying options for interventional, but as of right now, it directs you to 1224.28 for supplemental surgery. So that's been a big deal, because what happened, they added the definition for interventional. They added into the definition the term image guided. So a lot of these types of equipment have image guided facilities that are used for treatment, and they're considered invasive at this point in time, and do trigger some additional requirements. So again, this is treated a little differently than a standard equipment replacement, because you have to identify the procedures. Now, CDPH blesses the procedures, you're fine. If it does move it into a new category, you may have to upgrade the room or relocate the service. So let's look at an entire department. And the entire department's not being remodeled. The basic use of the department is staying basically the same. And this, as an example, this is an imaging department. But the areas in green are being renovated. That's the only areas that construction is going on. Your department has to meet the functional requirements for the use that's going into it. So if you have an existing soiled utility room and you're going to reuse that soiled utility room, there is no need to upgrade it. It's existing, it stays the same. You don't have to touch it. If the clean storage room, I'm just poking at these rooms as examples because I have no idea what they really are. If the clean utility room is being remodeled, it needs to meet current requirements for that clean utility room or nourishment room, whatever it might be. But if it's a clean room and a soiled room, they're existing. You're not otherwise touching them. They remain as is. You can identify them as they're required for the functional use of that space, but no construction, no upgrade required. Let's make this a little bit different. Say that everything on this floor is being gutted and remodeled. And over here, you have these green rooms designated. So just, again, using your imagination, these are patient rooms. They're very old. They were built in the 1960s. They have a single toilet, only in a single hand washing fixture in the toilet area, but not in the patient room. They're completely out of compliance, no accessibility, but the rest of this floor is being demoed and rebuilt around those 5 rooms. Okay, everything new going in must meet current code. Those 5 rooms can remain as is with no further upgrades. Now it would behoove the owner to upgrade those rooms and bring them up to current accessibility and all the requirements. But if there is no construction inside those rooms, including if they can paint, refloor them, etc., there's no other requirement to upgrade those rooms. Okay. That being said, just because OSHPD is not triggering an accessibility upgrade, the owner is already liable for providing accessibility, and actually throughout their facilities, even today, under current conditions, they should be accessible. So just because OSHPD is not triggering that accessibility doesn't alleviate anybody of any responsibility or liability to upgrade for accessibility. We're just not telling you you have to do it because those rooms are not within the scope of this project. So with that, I would just ask you to just really pay attention to identifying what the scope of your project is and clarifying that scope, and it'll head off a lot of issues later on. So with that, I'm going to open it up for any questions.
Great. Thank you, Richard, for that great presentation. I do want to remind everybody to go ahead and type your questions into the GoToWebinar panel, and we will be able to read the question out loud and hopefully answer it and give you some good information. I do also want to remind everybody on this webinar that if you have a specific question for a specific project, please use your field staff, your OSHPD field staff. That's your regional compliance officer or the RCO, the compliance officer or the CO, the district structural engineer, DSE, or the fire life safety officer, the FLSO. They are a great resource for you for your projects. If you have general questions, feel free to email the general question to webinarroom@oshpod.ca.gov. Again, that's webinarroom@oshpod.ca.gov. So with that being said, I'd like to go ahead and read off the first question for you, Richard. The first question will go way back to about 10 after 10. And the question reads, you say there is no change for construction from med-surg to pediatrics, but if you have a formula room, doesn't the mechanical code require the filtration of that room?
Okay, what I said was there is no change or no requirement for construction if you went from pediatric to med-surg. If you go from med-surg to pediatric, there are definitely different requirements for a pediatric unit. And what I'm going to do, I'm going to flip back to that slide. It's right at the beginning, but there are definitely requirements for an exam room, play area, as you mentioned, an infant formula room, isolation room, storage room. All those requirements do have to be added if you're going from med-surg to pediatric. What you do not have to do is upgrade the patient rooms, soiled, clean utility rooms. All the existing functions that are remaining and they're not being otherwise touched do not need to be upgraded. If you're going from pediatric to med-surg, you can conceivably, and we have done that without any construction. We actually had a project, it was a $30 million project because they were upgrading everything to current code and they actually heard this presentation, stopped the project, wasn't under construction yet, but it was in plan review, stopped the project, went back and came back in with a 0 construction project.
Perfect. Thank you, Richard, for that. We have another question, and this question is a little bit long, but I'll go ahead and read it to you. The question reads, how does this CAN apply to seismic anchorage of existing utilities which are extended, for example, existing conduit where new wire is being pulled? Are the reused components considered to be elements of new construction, quote unquote, or does only the newly constructed portion require seismic anchorage to current code, or does the existing portion also need to be retrofitted to meet current code?
Yeah, all the new construction has to meet current code. If you're pulling wire through existing conduit, those do not need to be backtracked and brought up to current code. That being said, if you're accessing this space, it might be a good time to bring them up if they are not compliant with the NPC requirements for bracing. But there should be no trigger to do so if you're just reusing existing components. We're not going to make you go back and re-conduit or re-brace the entire facility because you have a head end on the other side of the hospital. Again, all new elements do need to be anchored and braced according to new code, but you can reuse existing conduit. Hopefully that answers the question.
Great, thank you. We have another question for you. The question reads, if a SNF generator has a repair that has to have it removed for the repair, temp generator was installed. When we come back to install it, do we need to provide updated code compliant items, for example, additional exhaust vertical pipe, change in anchorage, etc.?
Your anchorage and the attachment and the installation of that new generator do need to comply with current code. If you have issues for exhaust pipe locations that are non-compliant with the current code, but they are compliant with a previous version of the code, that is okay. Again, you know, we can't, if you're just doing an equipment replacement on this generator, we're not going to make you relocate it because now it is no longer an equipment replacement. But there are things that you need to be aware of. And yes, you do have to meet current requirements for anchorage and so forth. But again, if there are existing conditions affecting that generator, such as the location, if it was installed in compliance with the previous version of a code, it does not need to be altered to be brought up into the current code.
Great, thank you. I do want to go ahead and thank everybody for submitting your questions. We have a great list of questions now. This next question, Richard, I'll go ahead and read it to you. We need 3 feet around the table, but what about to the side or behind? And it says gantry, but I'm assuming pantry?
No, it's gantry. Gantry is for the imaging equipment.
Perfect.
You need to have 3 feet of access around the equipment. Typically, it's on 3 sides. There are a few requirements where it does go all the way around the equipment. It's 3 feet at the loading. Basically, they want access to the patient on the table as well as accessibility around the table or gantry. But you do not need it behind the gantry between the wall in most cases. I think there are a couple pieces of equipment that do identify 4 sides, but most of them are 3 sides, each side of the table at the foot of the table.
Perfect. Next question. For projects that require CDPH's blessing, such as the CT replacement example, what is the proper procedural workflow for the project, i.e., what CDPH form do we use to apply the procedural use blessing? Do we engage OSHPD first? Have OSHPD reach out to CDPH? What do they do?
Good question. What you do is you add all the procedures that are being done in the room in the functional program. It's actually already a requirement, but a lot of people skip over that portion. But you want to put the list of procedures in the functional program when you submit the project to OSHPD, and we will coordinate with CDPH with the type of project and the list of list of procedures with CDPH to see if they have any questions. There are occasions when we do have a meeting afterwards to discuss things that might be kind of borderline, and or if there's one or two items that alone are prohibiting the use to remain as a diagnostic, so that you can make the decision that, well, we won't do those procedures if it's going to trigger a lot more construction. But basically, it's the functional program is required to be filled out with the list of procedures, and we'll take it from there.
Perfect. Next question for you is, if imaging equipment change out only, would the habitable room requirements at CBC 407.4.1 apply?
Yes, this is primarily a problem when they're not in suites. We are trying to deal with that issue right now because you don't want an MRI with a door going out to a corridor. That basically goes in the face of any logic for those types of rooms. So we are trying to deal with that, but they are considered habitable rooms. And that's, again, 407.4.1 is not a code that OSHPD writes. It's a state fire marshal code. And so we have little power in changing that. We do work with state fire marshals, trying to revise these, but as of right now, imaging rooms are considered habitable, and that is been an issue. So if you can put them in suites, for now, I'm sorry, that's the best answer I can give you.
Great, and if we can provide the code section here for 407.4.1, it's for those that don't know, it's direct access to a corridor.
From a habitable room.
Yes, correct. And it reads habitable rooms in group I2 and I2.1 occupancy shall have an exit access door leading directly to a corridor. And there are exceptions. So go ahead and if you like and are all interested, do look up that code for those exceptions. Next question.
An example of where we have made an exception is like the pharmacy compounding rooms. There's no way you can get out of those rooms legally under so they basically are considered non-habitable because they are not used all the time. So that is one way we got around that. But this, again, it's something that we are continuing to work on to help clarify that language.
Great, thank you. Next question. In cases where temporary MEP equipment are needed for, say, a normal generator, chiller, or air handler alteration project and not an emergency replacement project, would the temporary work need to be submitted under a temporary work permit or submitted with a normal permit?
Actually, it's your choice. You can do it either way. A lot of the times with the temporary equipment, it's not known up front how the exact logistics, and those are done oftentimes separately during the project. It is not an ACD of the project. It would be a separate permit, but you can include it in the original project. If you know exactly what you're planning on doing, you can include the temporary work within the original permit.
Great. We got a lot of questions for the alterations, of course. The next question reads, during an alteration with no change of occupancy or use, if there's an electrical, mechanical, or plumbing system that only passes through the renovation area, for example, a TI, that is not compliant with current code, does this system need to be modified to meet the current code? In the above example, the electrical, mechanical, or plumbing system is not used with the project scope, but only passes through.
And the general answer is no, you do not need to upgrade it. Again, what we tell owners all the time, the rest of the area is demoed. Again, it depends what's non-compliant. If it's just bracing, go ahead and add it. If you're MPC compliant, go ahead and add the bracing while the room's open and you have easy access. It's better than coming back in later into an occupied space and doing it. But as a general rule, you should not be required to upgrade those systems if they're not otherwise being touched in that space.
Great. And this next question kind of touches on what you just explained, Richard. So I'll go ahead and read it anyway. And they're looking for confirmation. So the question reads, we have always made an exception for pass-through utilities not used by the remodel scope, or when utilities pass through but get tapped. Sorry, we make the tapped portion compliant, but not fix utilities upstream or downstream from the remodel project. Can you confirm this position?
That's correct. That's kind of what I was explaining ahead of time. Again, it behooves the owner to take care of as much as they have access to during that project, but there is no requirement to do so.
And next question, regarding a renovation that does not trigger an OSHPD project and existing fire alarm is not compliant, what is required of the fire alarm?
A renovation will trigger an OSHPD project. It may not trigger construction. If you have an existing alarm system that's not compliant with current code, there may not be any requirement to upgrade that as well. Say if you're going from pediatric to med surg, as I mentioned as in the example before. But if it's a fire life safety issue, that may override the requirement. So I would definitely talk to your OSHPD team before submitting to see what the extent is. If you're going to do a zero construction project, a lot of people aren't used to that, including our teams. We don't see a lot of them, but they have come through. So I would definitely recommend scheduling a meeting and talk through the process to make sure you're thinking this is going to be a zero cost, but yet all of a sudden you do have these actual triggers that do require some upgrades, something you might not have thought of before, such as converting patient rooms to offices. Now you have to do things with the doors or the egress or the corridors. So you have to be really careful about that, and I would definitely meet with us prior to doing that. But again, fire alarm, if it's in place, it's working, and you're not doing any changes, there should be no additional requirements to do so. But because it is fire life safety, I would definitely talk to the fire life safety officer and confirm that.
Perfect. That's a great answer. Yeah, again, and I'll go ahead and reaffirm what Richard is saying. Please go ahead and talk to your field staff, OSHPD field staff, for specific questions. Again, they are a great resource. I'll go ahead and ask this question, Richard, and it might be a lengthy answer. It might need a discussion offline, but
or its own webinar.
So the question is, or the request is, please recap for OSHPD 1 facility converting to an OSHPD 5 facility.
OSHPD 1 to OSHPD 5. Basically, you're going from med surg to psych. And that's significant. That would be a very significant project. I've actually done those myself. You're looking at change of type of patient population, change in types of regulations, change in section within the code. So a psych unit has a lot more requirements functionally that would be required. Now, it doesn't have all the same utility requirements, so there might be some benefits there, but you're going to have to go through the whole facility and identify what's compliant, what's not, first in your planning and then in your utilities. It's not to be taken lightly. And going to a psych unit, it's a big effort just because of the safety requirements and the different population requirements. I don't know if I answered all of that, but it's not a simple process. And if you're going from OSHPD 1 to a 1R, it's probably actually simpler because you're just downgrading it. But going to a psych unit, there's a lot of things that need to be upgraded, even though not everything is an upgrade.
Great, thank you. And again, that might necessitate a lengthy discussion or just some dialogue. So whoever submitted that question, please feel free to email us at webinarroom@oshpod.ca.gov if you'd like to have a more in-depth conversation, and we would be happy to take some time and explain that to you. So again, reiterating that reaching out to your field staff is a great idea, and they are a great resource. This next question might have that as one part of the answer. So Richard, replacing a cooling tower that failed, what is the implication to structural upgrades beyond the scope if we only have a few members needed to be added at anchorage points?
Well, if it's failed, I'd definitely be contacting your compliance officer or RCO to talk about it, because it's probably gonna be an emergency project. Which item is this?
This is,
Okay, I see it.
Yeah.
You do, I mean, structurally, you do need to anchor it, and it has to be secure. If you're replacing the unit and there's different requirements, those requirements are going to need to be met. Again, for an emergency type project, you may be able to do some of the work prior, but only with the RCO's blessing, permission to do so, and it will need to be fully compliant once it is completed. So you want to make sure you know what's expected and that it's engineered correctly when you're installing it. Now, turning that around a little bit, and you're saying you're just going to replace a cooling tower that hasn't failed yet but might be getting old, and you're considering replacing it. Again, the scope of the project is replacing that tower. You're still going to have the same seismic requirements and anchorage requirements to do so, and anything affiliated with that upgrade can be done as part of that project. But what it won't do is trigger additional work beyond that. And that's what we're kind of trying to emphasize here. Really define the scope of the project so it's very clear what this project is doing. What we're trying to do is avoid, oh, you have to upgrade something downstream that you didn't consider. And if that is happening and you don't agree with it, definitely raise the question. Reference this CAN often and contact us. And I know Caesar has mentioned it a few times, but if you have questions that go beyond what we're talking about here, feel free to contact us either at the webinar room email address or at the regs unit email address. We'll be happy to discuss any of these items with you.
Richard, when dealing with cosmetic work, the question reads, although paint and carpet do not require a permit, does the ACO or area compliance officer look for smoke production and flame spread of the carpet, non-toxic paint, etc.? Do the materials require approval before purchase?
They may ask to see, that's why I was mentioning earlier, to contact the CO, your compliance officer. They do want to make sure that the materials being put in are applicable to a hospital or a nursing home or whatever it might be going into. Yes, they may ask about flame spread. Even in re-roofing projects, they're going to want to look at the product going in there, at least look at the spec sheets. Again, talk to them, ask them what they want to see for this. And like I said, I've literally turned away projects that were 100% cosmetic upgrades because they thought they had to submit a project. Another example is if you're doing tile work in a toilet room, you're remodeling it, or not remodeling, but basically doing cosmetic only in a toilet. You're removing the tiles, and to do that, you have to remove the hand washing fixture and the toilet. But you're putting everything back in kind. That is still cosmetic. Okay, you're just replacing the finishes. And tile's not such a big deal, but like carpet or wallpaper, things like that, there may be flame spread or smoke type ratings that they may ask about. Okay, so that's why I did say, I want to clarify that for cosmetic work, a permit that may not be required, but you do want to contact the compliance officer to not only let him know what you're doing so that he knows there is something happening in the facility, but also so they can check that stuff to make sure that you're putting in a product that is going to be compliant.
Great, thank you. We have next question dealing with air handler units. When replacing large AHUs in an OSHPD 1 facility, You are not required to rebalance all the areas served by this unit to current code. So are you not?
Question or statement? Again, there is a requirement to balance the air that you're serving. Now, again, it's going to depend a lot on the area being served, what functions in there. You know, if it's an OR, it's going to be a way different requirement than if it's administrative. There are actually some clarifying statements there in the narrative in the code for that when it would apply to rebalance. But there, you need to expect there's a certain level of rebalancing when you put in a new unit. A lot of the questions we get are about the pre-balance report before you do that. You know, if you have an HVAC unit that's not running, what do? You can't balance the air because there's no air coming out of it. And what you have are a couple options. If you have the original design drawings for that, you can balance it to the original design levels. The other thing, if you do not have those, you do have to present to the OSHPD team basically a proposal based on current code. This is what's required in these rooms, and we're going to balance it to that. So there is a level of rebalance that would be required.
So we want to know, does the PEDS to Med-Surg zero construction cost change require a permit?
Yes, all projects would require a permit. But basically what I call it is a conforming permit or a conforming project. It's the same thing if you're doing a removal from acute care service. You may not have any construction, but you need to show compliance. So what you're going to do is you're going to have a set of documents showing your existing pediatric floor and identify all the requirements or all the rooms that are in there. And then you're going to have your Med-Surg floor, and that one you're going to identify all the requirements for the code and show us where they are located. And if any rooms that are no longer needed, you're going to change them from a playroom to a waiting area or some type of other area. Just identify that, what those are. But you're going to probably have soil utility, nourishment rooms, clean utility rooms. They're all going to be reused. Identify those in the existing, call them out in the new as the same type of room, and you submit that and just show conformance. It's a very small set. It's usually just a few sheets of drawings that you will be submitting. But again, we don't see a lot of these, so people do get confused when they see them. And so I would definitely call and tell them what you're doing, and you may even get me involved so we can walk through the process.
So when dealing with fire alarm annunciation upgrades, do modifications to modify and enlarge a toilet room meet, do they have to meet accessibility requirements? Do they trigger requirements of fire alarm annunciation upgrades to meet current code?
Which question is that? Sorry.
So this came in at 1041 from Joe. Do modifications to modify or enlarge a toilet room to meet accessibility requirements trigger requirements for fire alarm annunciation upgrade to meet current code?
It may. Again, you're remodeling, now you're remodeling the space. You're changing the toilet room, you're remodeling it. So it would probably need to be fully compliant. I don't see the question on the list, so I'm trying to go from what you're telling me. Oh, there it is. Yeah, if you're changing walls, it's a remodel. It's, again, you're defining the scope. Everything in that room now is considered new for an alteration. So that room needs to be compliant. Especially if you're changing walls, you're going beyond. Before we were talking about equipment replacement, not triggering accessibility. This would trigger accessibility. This would trigger compliance with the fire alarm system. So if you have an old fire alarm system in the building and that's what's being served, and you're putting in doing accessibility upgrades, there may be an alternate method of compliance required to keep the existing fire alarm system. The intent is not to make you replace an entire fire alarm system because you're upgrading one room. So I would definitely, again, make a phone call and talk to your region supervisor.
Great. Next question. Is a remodel project that is not changing the function or uses of the space or spaces and the scope of work subject to additional support space requirements in current code versus original code cycle?
I'm not sure I understand the question. Is a renovation project that is not changing the function or use of a space subject to additional support space requirements? If you're changing, I'm going to guess you're changing function of a space, even though it says you're not. If you're changing the function of the space, you have to meet all the functional support requirements for that space, such as we use the example of the med surg to pediatric. If you're not changing the function, and you're doing a remodel within a med surg to med surg and just remodeling the space, then the existing support spaces, even if you have an old soil utility room that's not being touched, you do not need to upgrade it. It goes to the example about the patient rooms that are out of compliant with current code, but were built in compliance with the code at the time it was built. The same thing would apply. I think maybe that's where you're going with this. You're renovating med surg to med surg. You're doing some remodels, but you're not touching the soil utility room or clean utility room or nourishment room, and you want to reuse them. No further upgrades would be required to those rooms if they are not in the scope of the work. Again, you need to define the scope of the work. If those rooms are out of that scope, you're saying there's zero construction in here. Those should not even be looked at other than to show conformance with the requirements for the department.
Great.
If you have any other questions on that, Mason, just give me a call, but I think that's where you left.
Great. We have another question dealing with changing function, looks like. The question reads, when moving from ICU to ED function, is it possible to move into the old ICU room as ED bays without any change? What functional requirements would need to be met? Is there a path using AMCs to minimize construction work?
Going from ICU to ED is actually pretty significant as well. Can you minimize the amount of construction? Yeah, you can use the ICU rooms as ED bays, but you're gonna have to look at the clearances required for the ED. Again, you have to meet the functional requirements of the new use. So a new emergency department is gonna have clearance requirements for each bed position, for each bay. It's gonna have nurse station requirements. All those things need to be identified and applied. And you have to show that you comply with the clearance requirements or space requirements, size requirements, et cetera, for those spaces. Now, if you're doing ICU to an ED and you happen to be reusing a soiled utility room or a med room, that's fine. But for the patient locations, you're going to have to show that you comply with those spaces, because those are not considered patient to patient when you're going from ICU to an ED exam area.
This next question looks like it has to do with TIs. Can you speak to the requirement on what must be done when an existing element, system, etc., is found within the project area during the course of construction, quote unquote, when it is determined to be non-compliant to its originally installed requirements? This is frequently encountered in older facilities.
If something is determined to be non-compliant, even when it was originally built, basically you have a couple options. You can flag it and correct it as part of this project. Again, it depends on what it is specifically. Looking, if you're opening up the ceiling, you see some non-compliant conditions up there, they were never non-compliant, your option is to correct it as part of this project, or the facility will be flagged as an existing non-compliant condition, and the owner will have to address it at some time in the future, probably before they can do any other work in that area. It's going to be flagged in our system as an existing non-compliant condition that needs to be corrected. So again, it goes back to, you have a space that's open for construction. Is it easier to get in there and fix it now? I would recommend that they do so. Is it required to do so? Again, it goes back to that pass-through question that came in. You have existing non-conditioned or non-compliant condition passing through a space. No, you do not have to correct it. But do you really want to go in there and correct it later at another time and interrupt that space when it's in operation? Yes, you see these all the time in older facilities. It goes back to, is it required to be done now, or does it make sense to defer it? There is a choice, but you need to weigh the pros and cons for that.
This next question, it looks like it may be a question specific to a project. So again, a reminder, reach out to your OSHPD field staff for specific questions, but we'll ask it anyway, Richard, and it has to do with wall ratings. Are you stating if you change patient room stating an R or non-rating and it is a rated wall to the corridor, you do not need to correct the mechanical to be neutral? This has been a request that we must update the corridor as well as the patient room so that the fire rating is corrected, quote unquote, i.e. if the existing room is 75 CFM positive, but is no requirement on a rated corridor, do we need to make the room neutral as well as change the offset on the corridor so that it doesn't change the overall hospital?
What we're stating is that if you're remodeling, changing the use of a space, there are going to be requirements for fire upgrades. Fire life safety is big, and we're not going to provide a non-safe condition. The question is kind of all over the place, so I'm kind of trying to focus in on where you're going with this. But if you're doing a change in use, the corridor may need to be upgraded depending on what that use is changing to. You can't have a non-compliant corridor system for the type of use it's going into. As far as the air balance, I'm not sure where that's coming into this question. So I'm not going to go there, but I would say go ahead and contact me through the one of the other emails that we presented, regs unit at oshpod.ca.gov, and we can talk about it. But there may be requirements that you do upgrade corridors. Again, you're changing the use or the function. There may be certain requirements for fire life safety that do need to be upgraded. So again, if you have questions like that, call us. If you're going from, again, a similar use to a similar use, and the walls are compliant, there should be no further requirement to upgrade them. So that's the best I can do with the information I'm seeing there.
And again, that might be a project-specific, situation-specific question. So please feel free to email us or reach out to us, and we can definitely provide a little more clarity on your specific situation. Next question, Richard. Where in the CAN does it state that the imaging equipment replacement and associated room prep does not require accessibility path of travel requirements?
It's going to be in the accessibility CAN when it's released. It's not addressed in the remodel CAN, but I just threw that out there as that is not something we're currently requiring for equipment replacement. It falls under exception 7. If you provide a new imaging equipment, it does fall into the category of the architecture of the building. If you're replacing what's already there, it does not.
Great. Here's a next question for you, Richard. If you need to replace the windows on an existing hospital leaking, do we need to comply with Title 24? My concern is that the window to wall ratio will be non-compliant as patient rooms need large windows on all sides of the building.
The answer is no. If you're doing a remodel, the energy requirements do not apply to healthcare facilities for alterations. I thought you were going to go with accessibility there, but I think it's 141 in the energy code. It exempts all licensed healthcare facilities for alterations currently.
Great. And the next question has to do with cooling systems. If I have to replace a cooling coil in an existing air handling unit with a larger capacity coil, would that trigger a rebalance of all rooms served by the air handler?
I would have to look at that, to be honest. I'm not a mechanical engineer, so if you can email us that question, I can get it answered for you. My implication is no, you don't, but I'm not a mechanical, so there might be some other requirements. Looks like they left, so they probably won't get that answer.
And that brings up another point we want to bring up is within our team here at Oshpod, we have a lot of resources, whether we have technical leads in mechanical, plumbing, electrical, structural, et cetera, et cetera. So if we have a question here that that we answered and you're not clear with the answer we provided, or you want to have a more in-depth conversation, please reach out to us and we would be happy to help you out. So next question, Richard. If during a repair project, water intrusion, an existing non-compliant condition is discovered, PVC, above ceiling, does a facility need to address the non-compliant condition?
If it's existing non-compliant, they do need to address it. Again, if you're doing a repair project, is it part of the repair? It would need to be replaced. If you just happen to see it when you're up there, again, it would be triggered as a future existing non-compliant condition. It's the same thing if the owner, it's the owner's call if they want to replace it now or later, but it would need to be repaired because existing non-compliant would trigger a condition be placed on the facility.
All right, so Richard, what triggers the need to issue a functional program?
Basically, anymore, it's almost everything. They say it's a change in function. We got a lot of arguments with, like, say, pharmacy. We're adding compounding the pharmacy. We're not changing the function of the space. It's pharmacy to pharmacy, but you're changing how the room functions. That's where it comes in. It doesn't need to be a full-blown functional program for a lot of these projects. The example is if you're doing imaging equipment replacement, you're not changing the function of the room, but because of the types of procedures that we need to verify, if you don't submit a functional program, we'll probably be reaching out to you and ask to provide it, or as a minimum, the list of procedures that are being done in that room. Again, it doesn't, these may be 2 or 3 pages, not these huge functional programs that we see a lot of. Really, it's just what's needed to get the approval of the project and to understand what the project's doing. And if it's very, very clear you're remodeling a soil utility into a soil utility and just moving things around, you probably don't need one. So when in doubt, just go ahead and give us a call or provide one. It always helps to have them. But again, don't put the huge effort into providing a 100-page functional program. It's a 1-page remodel of a toilet to a toilet.
Great, thank you, Richard. We have the next question. The question reads, will Oshpod consider interim phases in renovation to establish the sterile environment for a procedure suite?
John, I'm not sure what you're getting at there. Consider interim phases in a renovation to establish a sterile environment. Oh, for a procedure suite. This is for like an interventional suite. We are considering different options. We do meet with CDPH on each one. to look at what you're proposing. So what I would suggest would be propose something. We're trying to get some language through in this next code cycle to address specifically what you're talking about, or not even require these be moved to a fully sterile environment. Basically, you can have a sterile procedure room rather than a suite. So that's where we're trying to go, but currently that does not exist. And but we are working with CDPH on a case-by-case basis. So go ahead and submit a proposal to us, John, and we'll see what we can do to help you out. Some of these are going through, and I'll tell you, a lot of them are not, and it's really procedure-based.
Richard, is a re-roofing project considered a project or just cosmetic?
Re-roofing is a project. There are expedited permits for small, I think under 400 square feet, like patching a roof, but a re-roof project would be considered a project. We're actually going to be submitting an expedited permit package for re-roofing for skilled nursing facilities, but a lot of the tips in there can be used to apply to regular projects. But yeah, re-roofing is a project because there's other things to be looked at rather than just the material going down. And a lot of these are being reviewed in the field, so they're pretty quick. We're looking at what equipment's being removed, reinstalled, re-anchored, slopes of roofs, things like that. So there's a lot of things that go or that are involved in that. But they are typically reviewed in the field.
Great, thank you. We have a couple of more questions. We have about a little over 5 minutes left, so we're doing great on time, and we're nearing the end of the question. So next question we have here: in a cosmetic-only restroom upgrade, wall tiles will be removed and replaced along with wall-mounted accessories. In-wall backing may be relocated. Will this require a permit?
Yes. It's no longer cosmetic once you're opening up the walls and moving things around. So yeah, it would be a project.
And next question is: if we are replacing a failed domestic hot water tank at the end of and the facility does not currently have redundancy per current code, will our tank replacement project be obligated to provide the redundancy?
I believe there was discussion on that, and currently I think the answer is no, it does not. William, if you want to give us a call on that, we can confirm it. But I believe if you're just replacing what's already there, it's failed, you can put it back the way it is. It's not going to trigger current code.
If you're changing out the head and nurse call requirement in hospital, do you have to bring all the areas served from the new nurse call equipment up to current code? For example, if your support spaces that require duty station do not currently have them, need to be added now.
I'm sorry, can you repeat that?
Sure. If you are changing out the head and nurse call equipment in hospital, do you have to bring all the areas served from the new nurse call equipment up to current code? For example, if your support spaces that require duty station do not currently have them, need to be added now.
If you're just replacing the head end, that is your project. You're just replacing the head end unit. So no, it does not need to bring it's not going to trigger everything. Basically how we look at it is if your head end unit's going down or failing, you need to replace it. We're not going to require the entire facility be upgraded to the current brand new requirements or current requirements. You're just going to replace that piece of equipment that is failing.
Great. And last question that we have here, unless I see more come in, we do have 5 minutes left. The question is going to be, where can we go to see a list of what qualifies for an expedited project?
Go to our website under training. I'm going from memory here. We have a Google training or expedited, and you'll see a list. We currently have 4 expedited building permits process, and they all can be done online now. Most of them, actually all of them, are to do with skilled nursing facilities, water heater, handrail. What's the latest one? HVAC replacement. So those are your expedited building permits. There's one more. Oh, TV mount. We are working on some more for re-roof for a skilled nursing facility, as well as generator replacements.
And where, if an HVAC unit needs to be lifted and re-anchored for a roof replacement project for proper flashing, does it need to be brought up to code with the re-roof project, within the re-roof project?
No. No, you're allowed to remove and reinstall anything to its existing condition, unless it was existing non-compliant. You're allowed to put it back in to the code it was built under. That goes with any repair or maintenance.
Great. Thank you, Richard. And I don't see any more questions on the go-to question bar. So I do want to go ahead and remind everyone that we did upload the PowerPoint presentation onto the go-to software for your use and download. And we also uploaded the Remodel CAN 2-102.6 for your use as well. So feel free to go ahead and download those and sift through those. And if you have any questions regarding this presentation today, feel free to email us at webinarroom@oshpod.ca.gov. Again, that's webinarroom@oshpod.ca.gov. If you have specific questions from a specific project that you're scratching your head and you can't quite get around, feel free to reach out to the OSHPOD field staff, whether it's the RCO, the Regional Compliance Officer, the CO Compliance Officer, the DSE, District Structural Engineer, or the FLSO, Fire Life Safety Officer, and they'll be able to help you out with those specific projects. We do want to remind you that we do have some up and coming presentations that the dates are to be determined, but keep it on your radar that we will be presenting some presentations on existing building code renovations, California Energy Code for healthcare facilities, so a presentation on accessibility, CAN 2-11B, and some on functional programs. And if you're not familiar, our inspection services unit is doing one of our FBA 10s or Field Brief Advice 10-minute webinars tomorrow, and tomorrow's presentation will be dealing on electrical coordination studies. This presentation is going to be at 12 o'clock, and if you haven't done so, these presentations offer some information or clarification on items that you may encounter during your projects out there in the field. The presentation is a 10-minute presentation with a 20-minute open mic. Yeah, I said open mic, question and answer. So feel free to join us, and you can register for that by logging into our website. So if you have any further questions, email us or reach out to the OSHPOD field staff. We want to thank you for joining us and taking time out of your busy schedule to listen to what we have to say, and hopefully you learned something, and if not, you sparked up more questions that we would be happy to answer. So until next time, stay safe and stay healthy.